Well, hello everybody, and a very warm welcome to our Nursing Now Challenge Awards ceremony on this fantastic day, International Nurses Day. I think if somebody had have said to me 20 years ago when I started my career as a student nurse that 20 odd years later I'd be amongst amazing early career nurses that you're going to hear from today, and eminent leaders such as Elizabeth Iro and fantastic advocates for the profession, from THET to GER Mental Health, and it goes on, I would have said this couldn't be possible. So it's my absolute delight to be the chair of today's meeting and to be able to share with you the amazing work that our winners have been undertaking around such important topics for the profession. As you'd expect, compassion is right at the top in everything we do, but we've also got some really brilliant examples of where early career nurses and midwives in many different countries across the world are stepping up to the leadership challenges that we faced in living and coping with the global pandemic, COVID. We've also got amazing innovations that just blow my mind. It's been really difficult to pick the winners, but where nurses and midwives are innovating and thinking differently and using their education to really improve the way that they deliver the care to the communities that they serve. We've got research, which again, 20 years ago, research was always there within nursing and midwifery, but I think the passion and tenacity with which our early career nurses lead the charge around the research agenda is just fantastic, and some fantastic examples of how research is not only being designed by nurses and midwives, but also getting to the patients through them is just brilliant. We've got advocacy, which we know nurses are amazing at advocating for their patients and the communities that they work with, but some wonderful examples of how you can be an amazing advocate for the people that you care for. And as ever, collaboration and partnership is our other theme. Without collaborating and partnering, we would not be where we are today. The Nursing Now agenda has all been about working with others, connecting with each other, and seeing how we can collectively amplify the voice of nurses and midwives and what they do. And this is only possible through collaboration. So I'd like to take this opportunity to sincerely thank all of the people that collaborate with us and the amazing colleagues that are with us today. So I think without further ado now, Hannah, I'll hand back to you, and have a great session, everybody, and can't wait to hear more about what you've been doing. Thank you.
Thank you, Lisa. We'll hand straight over to Elizabeth Iro, Chief Nursing Officer from the World Health Organization.
Thank you very much, Hannah. Greetings, everyone, colleagues and friends. It is a real pleasure to be here with you today. I wish you all a very happy International Nurses Day. It's a special day for us all around the world, and I hope wherever you are having some great celebrations, or you're having some great celebrations planned for the day. Whilst we mark this special day, I hope you will also take time to reflect on all that we have achieved. Nurses have faced extraordinary, unprecedented challenges during the last 2 years. I thank you for your strength and dedication, and particularly for your work to protect your communities during the COVID-19 pandemic. Whatever your role has been, you have played a part in a global commitment to protect our fragile planet. And I hope that despite the deep sadness and grief that many of us have experienced at the loss of loved ones, friends and colleagues, you can be proud of what you have done to keep your communities safe. The COVID-19 pandemic has taken a significant toll on nurses worldwide. Reports of burnout, sickness, intention to leave, and retirement are climbing, as are attacks, abuse, and violence against nurses. The rates of mental health illness among health and care workers since the onset of the COVID-19 pandemic is alarming, including the share among midwives and nurses. In some contexts, there has been a marked increase in international recruitment and migration. We have said many times that we must learn the lessons from the pandemic, and our time to do that is now. Our health workforce needs to strengthen, and we need to see investment in nursing at every level. This week, we have spent 3 days at a triad meeting, a meeting led by the World Health Organization, the International Council of Nurses, and the International Confederation of Midwives. This meeting was convened with over 800 senior nurses and midwives to discuss the operationalizing of the WHO Global Strategic Direction for Nursing and Midwifery, 2021 to 2025. It was an inspiring 3 days as we heard about the experiences and challenges that nursing leaders have to make the transformational changes that are needed in their countries. Priorities emerged from discussions around investing in our workforce. We must prepare for future global emergencies by ensuring our emergency preparedness plans are clear. We must learn from conflict situations and ensure health workers are protected from attacks and supported to continue their work. We must develop great nursing leaders addressing the issues around gender equity and inclusion. And we must continue the momentum to build and strengthen our relationships across all our global partners. I've said many times that our strength comes from communication and collaboration when we work together and face our challenges head on as a united global community. During the pandemic, we adopted new technologies to connect with each other and with our communities. We must harness these and use them as mechanisms to bring us all closer together. 2 million midwives and 28 million nurses need that together. Midwives and nurses comprise more than half of the global health workforce. Our collaboration can strengthen advocacy and policy messages on shared issues. Collaboration among multidisciplinary teams is essential to maximize the contributions of each professional group in the delivery of primary health care, achievement of universal health coverage, and the attainment of the SDGs. As you know, the WHO has developed a global community of practice for nurses and midwives around the world to connect, communicate, and collaborate. We officially launched this today, and I hope you will join us. It is for you, and I hope you will find it useful. So on this special day, I thank you once again for everything you do. Nurses are one of our most valuable professions, and I'm honored to work with you and celebrate all that we do. My message for the future is one of hope. Hope that as we take our next steps, we work together to face the challenges ahead. Our priorities to protect, safeguard, and invest will set us on a course to strengthen our profession. And on this special day, I send you my heartfelt good wishes and hope you have a joyful day. Thank you very much.
Thank you so much, Elizabeth, and thank you so much for being with us today. Now we are going to hand over to Dr. Rhoda Radilla, who will be presenting the Leadership Award.
Happy International Nurses Day, everyone. I am so honored to announce our winners of the Nursing Now Leadership Award. First, to Sana Gul, who is a community health nurse and assistant manager, digital health at Aga Khan Health Services, Pakistan. Okay, let's applaud for Sana. Next is Mohammed Bodber, a nurse from Sudan, public health nurse from Sudan, who works at Medicines Sans Frontiers, France. Please join me in congratulating Sana and Mohammed. What a truly, truly special time to be recognized. As I deliver this keynote and reflect on the primary mission of the Nursing Now Challenge, it takes me back to my beginnings as a nurse in my home country, the Philippines. While I was privileged to receive excellent education, achieving my bachelor's degree back then, after graduation, it was a challenge landing a job. You had two options. One is spend a costly amount of money for additional training at a city far away from home, hoping that your new skills will give you the edge to get a job. Or volunteer your time at a local hospital, but you need to get on a wait list to do that. Then once you're hired, you enter the workforce with such zeal and commitment, but soon enough, you will find out that you will need to be exceptionally resourceful to deliver the quality of care you have envisioned as a new nurse, or facing complex patients you are not quite prepared to care for. And I share this with you now because I know that some of these conditions have not changed in many parts of the world. Seeing these experiences firsthand made me pledge to give my unconditional best each day for our patients and our profession, finding every opportunity to give back. And remember, I said I arrive at this reflection thinking of the primary mission of the Nursing Now Challenge. And that same mindset I know has inspired our Nursing Now leadership winners, Sana and Mohammed. Sana founded the first student research society led by nursing students at Aga Khan University, and influencing her institution to decrease the pay gap for nurses and midwife. Just wow, right? And truly extraordinary. Mohammed, who organized the first global health nursing course all over the world and leading nursing students across the country to increase awareness and strength of their leadership. Sana and Mohammed, they are bright, shining stars to all of us. Is there a word stronger than commitment? Or is there a word that converges courage, dedication, and brilliance all together? That's a way to describe Sana and Mohammed. They possess those skills that healthcare needs right now. As a young nurse, I had the opportunity to interview the oldest living nurse in my hometown. This was back in the Philippines. She was almost 100 years old then. If I'm not mistaken, she was 96, turning 97. She was almost 100 when I spoke with her, but had vivid memories of her service as a nurse. She shared her autobiography and journal with me, and you can imagine how I was having goosebumps reading through the pages of her journal afterwards. Her name was Rafaela Biteng from the Philippines and received the Florence Nightingale Award from the International Committee of the Red Cross. She provided care during World War II and recalled caring for wounded soldiers at gunpoint. Can you imagine that? It's just scary thinking about it. And administering vaccines and home deliveries, crossing rivers and streams by foot. She inspires me deeply, and her experience resonates with what Professor Lisa Baylis-Pratt said in her interview, like the 5 questions with Professor Baylis-Pratt that was recently published. Nurses and midwives are often the first, and in many cases, the only healthcare professionals that many people in local communities can access. Her experience, Rafaela Biteng's experience also brought to mind the International Council of Nurses statement regarding the situation in Ukraine. Nurses and healthcare workers deliver care and treatment to all patients without fear or favor. We are standing at an extraordinary time of new beginnings. In a recent newsletter, the president of the American Nurses Association of New York, I'm here in New York right now, I'm working in New York. The ANA New York president referred to staffing conditions as a leaky bucket. Hospitals and organizations are losing nurses as they are gaining them. Really, really sad, right? Many new to practice nurses, early career nurses who received limited in-person training are terrified as they transition in their new job. Imagine working in an emergency room for the first time when you had most of your in-person, when you had most of your educational training doing simulated videos or just connecting through virtual educational sessions. Or experienced nurses who have hardly recovered from the exhaustion of the pandemic and are now precepting one new nurse after the other, multiple orientees to keep up with the demand. Nursing organizations are putting together programs that have an impact on retention, including pay that is responsive to the challenges of the surviving frontline conditions and healthy and safe work environments. And when we say safe, that means physical and psychological safety. What can we do? Going back to those programs that have an impact on retention and healthy, safe work environments, institutions and professional nursing organizations have partnered with other professional bodies for nurses to have access to a professional coach, for example. There's a program called Nurses Supporting Nurses, also by the ANA New York, which is a peer support program that pairs trained members to other members in distress for free, confidential, empathetic peer support. And we hear of many similar programs right within the institution or across, like or linking with other organizations. And that also reminds us again of the primary mission of Nursing Now, that's really connecting nurses across borders, across the globe, and having that shared experience and resources, together. My current role is Director of Nursing Excellence in Magnet Recognition here at New York Presbyterian. Magnet is the gold standard of nursing excellence, and only 8.9% of organizations in the United States have achieved this prestigious designation, and several organizations internationally. One of the main components of the Magnet model is transformational leadership, which reflects the importance of the ongoing development of leaders and the power of advocacy and influence to achieve successful patient outcomes. Through the narratives and success stories that Magnet organizations submit to achieve the designation, you will see how nurses are making a difference by having a voice. In one of our meetings recently here at my workplace about culture of safety, one of our nurses made a statement which struck me so much, and this was within the theme of avoiding errors, preventing errors, right? And she described how nurses are frequently interrupted while delivering care, and yet give their 101% minute by minute to deliver the best and safest care. These are situations, she said, that only a nurse at the bedside would understand. We need to amplify the voice of nurses and have leaders who are able to provide input in local, national, and global forums. And as if you ask me, when nurses take charge, it gets done. Lastly, I will share with you my personal journey as a nurse and a leader. I came to the United States as an immigrant and had to relaunch my career. Similar to many immigrants and what many immigrants go through, I started in a practice environment that was mostly unfamiliar to me. Language was just one of them. But with the support of mentors and peers, I somehow made it through those challenging first few years of transition. With English as my second language, you can imagine the joy and pride that I had when I first saw my first peer-reviewed journal article that came out in the English language. And during the peak of COVID, I also published my first book, and this year I was appointed as associate editor of Gastroenterology Nursing Journal, which is the premier journal for gastroenterology nurses. I'm not saying this to show off in any way. I'm sharing this as a way to inspire you that when you are guided by your true north, you will make it through. And my true north, I have found a while ago. That's finding every opportunity to give back. As we celebrate International Nurses Day together, let's come together and support each other and be reminded why we all choose to be a nurse. Thank you, everyone.
Well, that's fantastic, Rhoda. And I think the only thing I would say is you absolutely should show off. I think you should show off about all of the amazing things that Rhoda does. She's been an amazing advocate and support of the Nursing Now Challenge, and her passion for excellence is just palpable. So definitely show off, Rhoda, and I think we should all show off more as well with the brilliant work that we do. But I think without further ado now, we've got the winners of this first award, and I'm looking to Sana and her colleague. Are they there? Sana and Mohammed?
Yes.
Over to you to accept this award, Sana and Mohammed. Do you want to say a few things?
Thank you so much, Lisa. I'm humbled and honored for this amazing recognition, appreciation on this special occasion. And I would like to extend my thanks to Dr. Rhoda as well. And today I have the opportunity. I would like to thank Nursing Now for being there. As the global campaign started in 2019, and where I began my advocacy and leadership skills as a nursing student. And today, as a nurse professional, I am here with the campaign Stick to It. And during this amazing occasion, I would really want to thank all the partners for this amazing and continuous support. That includes the Birthday Trust of Nursing, WHO, TED, SAYA, Jaya Mental Health, Sabine, SameU, Institute for Healthcare Improvement. Thank you so much, everyone, for your continuous support, recognition, appreciation for the nurses and midwives globally. Without you, it could not have been possible. For my leadership, I haven't done anything amazing yet. I wish I could do more and continue my work, but thank you as a nurse, nursing student, as a young nurse, whatever I could do in my environment, in my surrounding, by using the platform of Nursing Now and my organization, with the support of my mentors, of course, and Lisa and Anna. Thank you, everybody, for training me, for inspiring me, and for giving me a voice to talk about nurses, and for improving the working conditions and recognitions and bringing the nurses to the spotlight. I'm behind honored to share this as well. Today, I appeared in the morning show of one of the largest media houses in Pakistan.
Wow.
And then there we shared about why we do celebrate this day, and about the importance of nurses, and why young nurses and young girls and boys should opt for the nursing profession, why it is so rewarding. And they were behind inspired of about listening to the stories that I shared to them, especially from the platform of Nursing Now. So thank you so much for this honor. Thank you.
Oh, thank you, Sana. And somebody's just put in the comments, keep soaring. And I think that's really apt, you know, keep pioneering and keep aiming for the stars, because I'm absolutely sure that you will get there. And what an amazing thing to do, to get on the radio this morning. I did the same in this country, actually. And it's just wonderful that radio stations are saying, tell us more about this International Nurses Day. What's it all about? So thank you for sharing the message on behalf of us all. I don't know if we've got Mohammed. Is Mohammed here, Sana, your colleague? Have we got him? I think he was here. Are you there, Mohammed? Here he is. Hello. Fantastic.
Hello.
Over
Good
to
morning,
you,
good
Mohammed.
afternoon. First of all, thanks Dr. Rhoda and thanks Dr. Lisa for a nice presentation. And I'm so humbled and honored to receive a Nursing Now Challenge Leadership Award. It's such an honor to be recognized among a lot of other colleagues from different parts of the world. First of all, I would like to thank all nurses who have worked hard to save lives across the country and across the pandemic and across the world as well. They have been showing their strong leadership and their strong engagement with the local community during COVID-19 pandemic. And I would like to deliver a special thanks to WHO Chief Nursing Officer, Dr. Elizabeth Ero, for her continuous leadership and continuous advocating for nurses at higher level at WHO. Also would like to thank Nursing Now Challenge Program Director Profisa, and Nursing Now Challenge partners, including all of them, including Saving Vaccine Institute, CMU, and SET. My leadership skills have been begun since I'm undergraduate, so engaging in the process of Nursing Student Association, and has been elevated to across the national, and then I worked across the regional activities. I'm now continuing to rising to advocate of nursing voice at co-chairing of the Africa Regional Health Challenges Committee. I would like to use this opportunity and send a quick message to our young nurses at the different parts of the world. To the nursing student, please get involved in your nursing association and show your leadership and act as a young leader. To my fellow colleagues and nurses, it is time now to show up, to rise in our professional and to be a good role model and leader. And to our senior nursing fellow, it is time now to engage of young nurse leaders in a leadership position, try to make sure that they have been handled in that position. Again, thanks all of you for this great opportunity. This is not this is a huge appreciation and a huge thing that has been put in our shoulders as a young nurses to be received a leadership award. We hope so for hopefully that we are going to alleviate the speech and to involve more nurses at leadership position. That's my key message for this. Stay healthy, all nurses around the world. Try to change our mind instead of going in clinical practicing. So we have to look at the other parts of the practicing, which is preventive. With your practice, you will save one life, but through the prevention, you will save billions of lives. And thank you all. That's my words for today. Over to you, Professor. Thank you all.
Lisa, you're on mute.
Apologies, I was on mute then. You'd have thought by now that wouldn't happen. I just want to say, you know, brilliant to be connected with Mohammed and his passion and his creativity. He's always there. If we ask him to come and join a webinar, he finds a way to be with us, to support us. So delighted Mohammed has won the award. And Mohammed, there's lots of lovely messages in the chat box. So if you get a chance, have a look. And just to say, Mohammed, no doubt, like many of you, is working today, so has took time out of his work to be able to come and be with us. So heartfelt thanks, Mohammed, and definitely keep going and keep soaring alongside Sana and many others. So we now move on to hear from Maureen Bisanyago, who is one of our Nursing Now Challenge Board members and certainly a source of wisdom, support and advocacy, actually, not only to me as the Programme Director for the Nursing Now Challenge, but to many others. And we're going to hear from Maureen now, who is 100% behind early career nurses and midwives, and offers us such inspiration and, as I said, support, but also new ways of thinking. So I'm sure hearing from her now will resonate with you. So over now to Maureen.
I'm Maureen Bisanyago, and I'm delighted to be here with you today to share some stories about two amazing nurse innovators and to demonstrate why I am so passionate and committed to nursing innovation. We have a global need for new models of care, and especially in this time of COVID, the need has never been more visible and more vital. The need is clear, and the path to innovation, in my experience, relies on three attributes. The first is IQ. We need to understand the basic fundamentals of science, of caring, of how to make diagnoses and how to produce health, to use new medications and technology, and to manage disease in this critical time. What's effective here is developing a learning system, and nurses are particularly good at keeping up with the huge amount of new research and innovation that's happening on the scientific side of care. The advances of science are critical for our patients and their families. The second attribute is EQ, emotional quotient or empathy. And it's a powerful driver for innovation. As nurses, we see the whole person, not just the diagnosis. We see the patient and the person, we see the caregivers and their families. We see their homes and understand what are the social determinants of health that mean so much to health and care in this time. The social environments contribute just as much to health as healthcare does. And I think it's so important because nurses have this empathy, this way of seeing and understanding with passion what a person is going through when they are ill or when somebody in their family is ill. As nurses, we see the supports that are necessary, and it inspires innovation when we're able to see the whole picture. It gives us empathy, and it also helps us with compassion. I've learned during this time of COVID that empathy is critical, that seeing what someone's going through is so important. But I've also learned that physiologically, empathy triggers a part of our brain that makes us feel sad because we see the pain someone is going through. But compassion, acting on that, doing something with kindness, innovation, and creating a new model of care triggers a different part of our brain, and it makes you feel good because you've acted on the sadness that you feel. With nurses, I think we have both. We have a strong sense of empathy, and we also have very active compassion, and it's giving us a sense of what's so important for us to build new models of care, new sites of care, new ways to provide care, and that's all helping us as a profession to move forward. The third attribute is CQ, curiosity quotient. And I think nurses are eternally curious. They're constantly asking questions and learning more. I know that many nurses do just what I do, and that is we harvest ideas from other industries, from other healthcare settings, and many times just walk into an organization and say, take me to the place you're proudest of. I have learned so much by asking that question, because in many circumstances, I would never have known to go and see what other nurses have built. So ask that question, work on your CQ. It was a lesson that I learned very early in my healthcare journey. I was a young ICU nurse, and every day in the new hospital where I worked, the new wing, I would walk through a 14-bed pediatric unit to get to the 14-bed ICU, intensive care unit. The 14-bed pediatric unit was almost always empty, and the 14-bed ICU was always overflowing with patients waiting in the emergency department or patients in the hallways. And one day, my CQ led me to go out and start looking at, are there other models of care that we might adopt at this hospital? I found telemetry and step-down units, and that gives you a little sense of how old I am. But I went to the nursing leaders and then the middle managers, and I said, why don't we take over the pediatric unit and turn it into a step-down unit? It meant that the pediatricians would need to move to a different, older part of the building. And everybody said, no, there's too much of an uphill battle. We can never do that. So I went to the hospital CEO and I said to him, we can solve this problem, I think, by looking at models of care. And he said to me, if you can convince the pediatricians to move into the other building, then I'll give you that unit. So I went to the pediatricians and I began to talk, as I was a young nurse, about why they should move, and they said no. I went back the next month and the next month, and after 6 months, I had learned how to be curious and how to communicate. I went into the 6-month meeting and I said, let me tell you a story. And you could see that some people were moved emotionally. They were touched by the stories I was telling. And then at the end, I said, it's not just this patient. And I extrapolated to the total population of people who could benefit from that. And then I told the human cost, the story from the patient's point of view, but the story from the family's point of view, the story from the nursing staff's point of view. And then I ended with the financial cost. And I found that that arc of communication was really effective on telling others what I found so inspiring in my innovation. It really made a huge difference to the care of patients in that hospital, but I never would have been inspired to have the courage to go and have those meetings unless I had been curious and created some innovative models of care. So that experience, I think, really gave me a sense of passion about innovation. And it's why I'm so delighted today to introduce you to the two winners of our Nursing Now Challenge Innovation Awards. The first one is Harriet Naiga. Harriet is a nurse in Uganda who came up with a totally different way to think about care for women in Uganda, especially young women. And she thought across the spectrum with her IQ, with her EQ, and with her CQ about how to build a new model that's producing better health and better care for so many people. It's really opening up the doors to a long and healthy life for everybody that Harriet is touching. And our second winner is Lindsay Roddy. Lindsay had a very different experience that inspired her innovation. In her clinical care in a hospital, she found that there was a detachment in some of her IV tubings, and it pained her that there was almost a serious complication for this patient. As nurses, we always feel the empathy and the pain when a patient goes through something like that. But Lindsay took action, and she went and began to study, is there a better way? Is there an innovative model? And has created now incredibly innovative models for how we can provide safer care. It's not only doing wonderful things for Lindsay's patients going forward, but Lindsay's story is inspiring all of us to see a problem and then to take action to solve it. So I'm delighted to be here with you today. I'm so grateful for these two nurse innovators and to hopefully inspire so many more out there in the future. Thank you.
Oh, fantastic. Always such a joy to hear from Maureen. Every time I hear her, I learn something different. So now I think, Harriet, are you there? Harriet is just amazing. She's been with us on the Nursing Now journey, really from the very beginning. And I had the privilege to actually meet Harriet in person and see her work in action in Uganda just before the term COVID ever existed. So Harriet, thank you for staying with us on this journey. I'm so delighted that you've been a winner for this award, and over to you.
Okay, I wanted to put slideshow. Okay. Thank you very much, Lisa. Thank you very much, Nursing Now. Thank you very much, the partners who have supported us, who have awarded us with this huge achievement. I'm Harriet Naiga, and I'm a midwife, founding director of Midwife-Led Community Transformation, MILCOT, and I am a Nursing Now Challenge champion. Today, I am so excited that I and my other friends here, we have received these awards specifically from Nursing Now Challenge. To my end, I would say that Nursing Now Challenge, you have nurtured me and you have seen my journey throughout. And I'm going to go through these few slides to show you what I do and how Nursing Now Challenge has contributed to my career development and also has contributed to the impact that I and my team are making in our community. Midwife-Led Community Transformation is a community-based organization that is providing sexual reproductive health to marginalized adolescents and young adults, focusing on prevention of teenage pregnancies and unplanned pregnancies. We also provide survival skills, life skills, so that these marginalized adolescents and young adults can survive, thrive, and also transform. MILCOT was formed out of my vision when I was in the clinical setting throughout my education up to bachelor's. And I used to find adolescents in the hospital suffering complications that could be prevented. And yet as a midwife, I was in a strategic position to provide preventive initiatives, to provide the information that these young girls need to prevent teenage pregnancies. But yet I was a bit limited in the labor suit. I decided to go to the community to provide education, to provide sexual reproductive health information. However, it could not be enough. We also need survival skills like vocational skills so that these girls can have a holistic approach of care to cater for their health and life at large. In these pictures, it is our work through the pandemic, because when the pandemic came, the marginalized groups could really hardly survive because they couldn't do their petty work that they are used to do. And at Milcourt Center, we used to receive groups of them, especially those whom we have been engaging, our clients and beneficiaries. They could come for food. And at Milcourt, it could also be hard for us. However, we partnered with some partners who provided us with relief fund, and we were able to give them food and also provided them with sexual reproductive health information and counseling on phone. And we also trained them in vocational skills, especially cookery, bakery, manicure, pedicure, and good enough, they graduated. We went ahead to mentor them in their community so that they establish their small-scale businesses. We are so grateful for the impact that this has caused, because the girls who could not have anything to do, they could just do transactional sex work to get money to survive. Now they can work for themselves. And what we have done is to go ahead and sign up for the Nursing Now Challenge. Milcourt signed up for the challenge, and we trained nurses and midwives in the community and empowered them in leadership and also in provision of adolescent sexual reproductive health services, especially to the key populations who always feel that they are segregated. And nurses and midwives here, they were empowered as community champions, especially to support them, to teach them how they can extend their services outside the clinic borders so that they go to the community and meet these people who need them most, and they are able to counsel them and provide the services there. With the Nursing Now Challenge project, we were able to reach over 900 marginalized adolescents and young adults with sexual reproductive health information, psychotherapy, and also sexual reproductive health services, especially family planning. And during the period of the pandemic, this was very, very crucial as many teenage pregnancies were prevented. So the impact of Nursing Now Challenge project, to me as an early career midwife, I felt that this is a huge, huge impact to the community, especially the step that I was able to take and bring it to the community level so that also the community leaders could get involved. Nurses and midwives were empowered and they felt motivated. Some of them went back to school, and because they had lost morale, they had lost hope, but now because of Nursing Now Challenge project, they feel that they are counted. Nursing Now Challenge has helped us to get more partners, to get more collaborations, because as Milcourt, we did not plan to do it alone. We collaborated with other health facilities and they enjoyed this move so that they could also support their nurses and midwives. They ended up promoting some of those whom we empowered, and they feel that they carry much value as of now. So
Fantastic, Harriet.
And through these collaborations, we have seen a huge impact, and the number of our clients who are accessing the care from our center has tremendously increased. They come looking for a midwife who can support them even when they do not need medicine. They come here and they seek for psychotherapy, and this has been a very tremendous impact in their lives. So the local and global recognition that I myself have attained is such an amazing thing in my life. And it has been because of Nursing Now Challenge. I remember the time in 2019 when I was selected to attend the World Health Assembly and the Young Nurses event at ICN. It was a point that made everything move, because as you have seen my journey, I was working under a closed bucket alone. I didn't know I could have support from such a global amazing movement. So the recognition I have got has been amazing. I was interviewed by Her Royal Highness, the Duchess of Cambridge, through the Nursing Now Challenge. Going ahead, I and my team, we have won the Award of Excellence in Uganda, Award of Excellence in Advancing Maternal and Child Health Care. And this has been so huge in our face, because such a little organization, but with an impactful mode of care, we have been able to be recognized by our country, which would be so hard if it wasn't Nursing Now Global Challenge campaign.
Fantastic, Harriet. I mean, it's just, it is phenomenal, and you can hear the pride and the passion and the determination within Harriet, a real role model to us all. And I met some of those young girls that were almost broken, actually, that were coming to Milcott to get psychological support, to build their confidence, and to give them life chances that they didn't even know were out there. So Harriet, thank you so much for all you do. Absolutely, I know you'll keep going, and we're all incredibly proud of what you do. And I'd now like to hand over to Lindsay, who is our other amazing winner within the innovation space, and was really fantastic in helping us kick off some tech talks, which was about how nurses and tech and technology actually go so hand in hand, and it isn't for another profession. Nurses can work with engineers, nurses can work with scientists, nurses can work with all sorts of people in order to deliver better care. And Lindsay's just been an absolute star, curating her own medical product. I mean, my goodness, what an achievement. So Lindsay, thank you as ever for your ongoing support to Nursing Now Challenge, and over to you to say a few words.
Well, I'm so humbled to be here. I wanted to thank the panel for this honor. Thank you for the sponsors that are supporting the Nursing Now Challenge. This is an amazing group here, and it's such important work that's really leading the way in so many areas across the world. And so I'm just beyond honored to be here with these nurses who are such impactful leaders and change drivers. I want to thank Maureen and Harriet. It's also, thank you, Maureen, for sharing your wisdom, and Harriet, thank you for sharing your story too. I love hearing about other nurses who are really making changes. What a fantastic way to celebrate National Nurses Day. So just a little snippet about my work, and then we'll move on to the next exciting things. But my journey really started after almost losing one of my own patients, when a life support delivering line pulled out as we were getting the patient up during standard care. And it was this experience, after talking to hundreds of other nurses, realizing that what I had experienced was not an isolated incident, and that nurses were taping things together to try to solve this, as we do, to try to do what we can with what we have to do the best for our patients. And it was that started this journey to create a medical device to change things in a way that nurses knew needed change. And so it was through that journey that I have seen the profound impact that nursing can have in this medical device and industry space. And devices are a part of our everyday work with patients. And in so many cases, nurses are involved. I mean, they're involved very little in this space right now, but that is going to change. Products are given to us, and nurses often work their workflow around the products, but it should be the other way around, because nurses have a unique and important perspective on how devices should be developed and tested. So they have such value in the space, and I truly believe in the ability of nursing to help change the landscape here, to create a wave of devices that are optimized to improve health and reduce healthcare disparities and empower nurses. And so it's so meaningful to receive this award, because I think the mission and values of Nursing Now are what is needed here. As identified by Nursing Now, the way we change the landscape is by raising the voice and the profile of nurses and midwives, and empowering our new nurses to question the way things are done, and really reach for what is possible. And so nurses are going to have an enormous impact on the medical device space. And I just want to tell everyone, your voice is valuable in this space. So,
fantastic, Lindsay, and truly inspiring, and keep being innovative and entrepreneurial, and who knows what will come next for you. But brilliant that equipment, we're not being seen as recipients of this vital equipment, but co-producers, thanks to the work that you're leading. So thank you so much for all that you do. We love to hear from you and appreciate it. So we now move to a great colleague, Jenny Clark, that's going to talk about her role within the Nursing Now Challenge, and her amazing influence, and why she gets behind Nursing Now Challenge. And Jenny, you're going to present the award of research, which is incredibly apt, given all the brilliant work that you've been doing. So over to you.
Thank you so much, Lisa, and thank you to everybody. Particularly thank all the nurses on this call. Nurses and midwives are fundamental to everyone in the world. And today is a wonderful day to celebrate all of you and to give everyone's thanks for all the hard work, the dedication, and the brilliance that you all show. So this event is really special today. I've been privileged with my daughter Amelia to be along with Nursing Now from the beginning. We started our charity in 2019, the same time as Nursing Now, and we got together very quickly and met the leadership and met everyone who has put together this extraordinary program. Now, why we feel such an affinity with nurses is based on our personal experience. When my daughter had her brain hemorrhages, in 2011 and 2013, one of the fundamentals that we experienced was the love, care, and compassion of nurses. When Amelia recovered, we decided that we had to do something to express the appreciation for all the help that we'd received, but also to understand and try and get more people to understand this huge unmet need in the idea of recovery in general. There's so much focus put on acute, not enough focus put on prevention, and certainly in our view, not enough focus put on recovery. So in the world of nursing and clinical expertise, recovery is very mixed up with the word rehabilitation. Rehabilitation from our very naive and unprofessional perspective, but the perspective, I think, of thousands and thousands of brain injury patients around the world, rehabilitation is a process. When you have rehabilitation services, therapies, you are doing so you can recover as much as possible of all the things that you need to take back control of your lives after your disease, after your life-threatening illness, and then move forward. And what nurses do above all is actually be the people every step of the way to help survivors and their families understand what they need to do next. So when we first met Nursing Now, and we met other wonderful people in the nursing community, the Royal College of Nursing in the UK, and I'd like to definitely make a call out to the wonderful Professor Aisha Holloway at Edinburgh University, because Aisha has worked with us and is very heavily involved with Nursing Now. And we came to the Royal College of Nursing and Aisha in particular and said, we really want to fund and support an education, a training program for neurological nurses to help them develop their skills. And one of the key components of the skills that's so essential for nurses to grow in their career and to become leaders is research, which is why it's such an honor to present this award and announce the winners today. I just want to say a couple of words about our research program, because it is a postgraduate certificate that Edinburgh University is running. We've completed 1 year and we're on to the second year. And the fundamental about research and nurses is that you are all at the front line. You can help provide the essential evidence to inform policy, to inform practice, and to inform best practice care. So as you go about your work, it would be fantastic for all of you to keep thinking about how you can help meet the unmet need, particularly in neuro rehabilitation. And I know that not many of you are particularly involved in this, but I'm sure lots of you know people who are. So we would love you to spread the word about the need for neuro rehabilitation nurses and to increase the population of nurses in this wonderful area. But I think that's probably enough about saying you, and it's much more important to talk about the wonderful winners. So I'm very privileged to announce that the 2 winners for the research piece of the Nursing Ward campaign are Faith Nawagi and Akila Jayamaha. Now, I know that both of them are here, and I've just had the privilege to meet them before we all started. And so I know they're going to talk about themselves and what they've done. But Faith is from Uganda and Akila is from Sri Lanka. And they have both done tremendous leadership roles in producing research work and focusing on the need for research. So I think I will just hand over first to Faith and then to Akila, if that's all right, Lisa.
Absolutely, Jenny. Thank you so very much, and for all your support. And I just want to say, look out for more around neurorehabilitation nursing and how we as a group of early career nurses that span across many countries in the world can spread the word and raise the profile of this important area of practice, to see, Jenny, how we can support you with your mission to make neurorehab nursing as high up on the agenda as it possibly can be. So a bit of a challenge there out to you, colleagues. We'll be back in touch soon, Jenny, to see what more we can do. But yeah, over now, Faith, to you. Where are you? It's great to see you. There she is. Congratulations, Faith.
Thank you, Professor Lisa, and thank you, Jane Clark. I'm truly grateful, and thank you to the Nursing Now Challenge and all the partners that SAMU, so many of them, and all that, and WHO for really gracing this event and giving me the honor for this global award in research. Quite frankly, research has been an interest that I've had for some time, and I'm grateful to be an awardee for this. Of course, to me, receiving this award really marks a foundation stone or build for advancing nursing research here in Africa. I look forward to one day having a center for nursing research here in Africa that is bringing together nursing ideas to guide evidence-based practice in the various health systems in Africa, but also in our very local settings, whereby every African in every small village would be able to be impacted through better quality of care that has been contributed to by the frontline people who are mainly nurses, that would eventually actually lead to evidence-based practice. Of course, I'm grateful to have this opportunity, but most importantly, here in Africa, we have a saying that says, if you want to go fast, go alone, but if you want to go far, go together. So colleagues, I've not gone this journey alone. I've been able to be supported in various ways, and I'm grateful to my parents, my family, especially my siblings, my parents, and the Kohli family that have accorded me the ability to have a sense of belonging and have values to be able to advance work and all that. I'm super, super grateful for profound friendship that has supported me through this career building and bouncing off ideas, especially in research that to me began 10 years ago. And I'm grateful to Ndejo Rollins for being that profound friend that has never given up on me bouncing my ideas to them. I'm also very grateful to a set of many mentors, quite frankly, that have believed in me and pushed me to the level of what I am today, but also most importantly, becoming someone who is really impacting significant change here in Africa and in the world. I'm grateful in that category. I'm grateful to Anna Iakone, Elena Fitzpatrick, Dr. Rose Navide, Professor Elsie Chiguli, Sarah Chiguli, Professor Francis Omaswa, Professor Lynette. I'm very grateful to you all. I'm also grateful to Dr. Roy Mobuke and Dr. Ian Munabi and Dr. Andre Veit. All these are professors that have pushed me to the brim of taking this research interest and skills that I've acquired to the doctoral level, where I'm currently doing my PhD at Makerere University, and they've been very immense supporters. Colleagues and friends from all over the world, I'm grateful to be here, and I look forward to more opportunities to advance research in the domain of elderly health, in the domain of health workforce, health policy, and through doing this collaboratively, just like how we are currently mapping the nursing governance across Africa through the Nursing Now Africa Regional Hub, where I co-chair these developments. So thank you so much, everyone, and over to you, Professor Lisa.
Oh, Faith, thank you so much. Such a joy to hear from you and hear about your network and all of those mentors that have supported you. And I think that's something very special, actually, about the nursing and midwifery professions. There's a lot of support out there, but many of you will know one of our themes with Nursing Now Challenge is about mentorship. And I think what you've articulated in that speech is just how powerful and important networks and mentorship is. And that's something that we strive to do and support at Nursing Now Challenge. But you're always there, leading the way, co-chairing the African Hub, helping to bring sometimes a bit of organisation and some discipline to conversations, but also your mind is wide open and you're forever going to look out on the balcony to see what more can we do? How different can we do this? So I'm so proud and privileged to know you, Faith, and I just can't imagine where you will be 10 years from now, but I know it's going to be somewhere incredibly influential and no doubt special. So thank you for all that you do. And now we're over to your colleague Akila. That is the other winner of this area. So Akila, over to you. Thanks again, Faith.
Hello everyone. Happy Nurses Day for all of you. I have no words to express my gratitude to Nursing Now Challenge team for honoring me with this Nursing Challenge Award for Research 2020. Research is always a teamwork. I would like to dedicate this award to all of my research team members to honor them for their commitment and dedication and work hand in hand with me, especially Recharge team. It is my duty to thank all of the pillars behind my research work. First of all, my research supervisors, Professor Sally Singh, Dr. Mark Omi, and Professor Savitri, for their tremendous support and the guidance. I must thank all the KIU family members, especially Vice Chancellor Professor Nilka Fernando and Dr. Jagad Senaviratna, Professor Valnakuru Surya, and Professor Tamara for their encouragement and provided opportunities. Finally, I must emphasize that research is embedded in nursing. Florence Nightingale carefully examined the influences of environment to the patient's health outcome, and she modernized the nursing care, and even she told her fellow nurses that the foundation of good clinical practice was to utilize best evidence to guide clinical decisions. As nurses, we need to continue her legacy. Thank you very much.
Fantastic, Akila, and well done for not letting us forget about Florence Nightingale, actually, on this very special day. You're absolutely right. She was at the forefront of that science and technology, wasn't she? And we're certainly carrying that baton on for sure, which is brilliant. And I hope all's well with you in Sri Lanka. I know there's some challenges in Sri Lanka at the moment. So, our love and thoughts are with you, and we're here to support you with our network and in any way we can. So I think now maybe shall we take a 5-minute comfort break, because it's quite overwhelming. I feel a little bit emotional, really, just hearing about your amazing work and being able to present these awards to you. So shall we take 5 minutes and then come back? I'm just looking at what's the time here in the UK is 10:05. I know that won't be the time in lots of different places, but shall we come back at 1:15? So 1:15, wherever that hour is, and whatever that hour is to this wonderful audience with us today. And thank you so much to everybody so far for such a special period of time. Thank you. Well, welcome back, everybody. I think we're just a minute now to 1:15, whatever hour it is for many of you in different countries. So we'll just sort of start reconvening. If people want to, in particular, if Amy and Rose want to put their videos on when they make it back. Here she is. Hi, Amy. Wonderful to see you. And I think Rose may be on her way. Amy, so just remind us, what time is it in your country?
It is 5:14 a.m.
Oh my goodness. Oh,
it's okay.
Gosh.
This is the best way to start the day with each of you.
Oh my goodness. Well, thank you so much. That was a very early start then this morning for you.
Hello, Professor Lisa. So my video was stopped.
Brilliant, Rose. Great.
Yes, my video was stopped, so I can't put it on.
Brilliant. Well, welcome back, everybody. We'll make a formal start. I hope you got a chance to stretch your legs and perhaps get something to drink with that little break that we had. I'm now going to hand over to amazing colleagues, Rose and Amy, who again have been right behind the Nursing Now Challenge with us, supporting our early career nurses and midwives and inspiring and providing different takes on interesting topics and making us all think a bit differently. And Rose and Amy are going to present the advocacy theme of these wonderful celebrations. So I think, Amy, we start with you, and then I think maybe Rose, you talk, but whatever works best. Thank you both.
Rose, did you want to kick us off?
Oh yes, I'll kick you off. So thank you. I want to start with some thinking notes to go to Nursing Now and Sabine Vaccine Institute and all the partners who have gathered us all here today. We wouldn't be here without you. I'm Rosemary Nakme. I'm an Executive Director of REM East Africa. That's a health equity organization. And at REM East Africa, our vaccine equity work has involved the capturing of stories of rural healthcare workers and profiling them to create conversations about what is working in rural and low-resource settings. This work has been partially funded by the prize from Sabine Vaccine Institute and Nursing Now. Together with AMI and other immunization advocacy champions, we have been engaged in webinars that have highlighted the different enablers of vaccine administration across settings. This work has highlighted the important role of advocacy, what it does in improving access to vaccines and improving service delivery, and most especially ensuring that the patients receive high quality health care. I hand over to you, Amy.
Thanks, Rose. To be an advocate takes one single thing, a voice. A voice, a tweet, a quote, or a promise. Imagine that. The ability to impact the entire world begins with one single verse. The courage to begin. My name is Amy Saley, and I am a registered nurse at New York Presbyterian Hospital, Weill Cornell Medical Center in New York City. Last year, in May of 2021, I was given the opportunity to use my voice for the Nursing Now community. Since then, my voice has traveled through over 150 countries and today to the ears of each of you. Over the past year, I have utilized my voice on many occasions to advocate for my patients, to speak up against injustices, and to increase vaccine equity and adherence. It is with this voice that I launched a project called Frontline Friends to benefit low-income communities throughout New York. While working on this project, I found myself thinking about my impact as a nurse. One of the themes for Nurses Week this year is making a difference. Everything that has happened over the past 2 years and counting will be written down in history books, textbooks, manuscripts, films, and documentaries. As history continues to take place, how will you be remembered? Will you be remembered as someone who spoke up or someone who stepped back? Today, I'm here to proudly introduce 2 individuals who did much more than speak up. Our first award winner is an incredible individual who has served as a nurse and leader in Nigeria. Over the past 4 years, some of his collaborations have included securing personal protective equipment, which led to an investment of over $5 million to provide visors to nurses working in red zones throughout Nigeria, obtaining a grant to train over 100 Nigerian nurses in infection control practices, and a collaboration which resulted in the donation of over 1,095 masks. He also partnered with the Queen Elizabeth Commonwealth Trust and 360 Degree Health Network on a grant which allowed he and his team the opportunity to provide health education campaigns and personal protective equipment to nurses in Nigeria. A blog written about this individual holds a quote from Martin Luther King, which states, "Somewhere along the way, we must learn that there is nothing greater than to do something for others." This nurse lives this quote every single day through his incredible advocacy work. The second winner, which I have the pleasure of announcing, is a nurse advocate and board member at the Royal Youth Mentorship Program in Kenya. Over the past 3 years as a nurse, she has spoken at several Nursing Now and global events, including the White House Global COVID-19 Summit. She has utilized her platform to speak out about supporting nurses to ensure fair pay, adequate PPE, and the recruitment of more healthcare workers to stop the shortage, as well as support training and research. This awardee is currently taking part in IntraHealth Switchpoint Future League, advocating for a healthier future, and is a member of the Challengers Committee. Her passion for community and humanism shines through as she has been involved in sanitary towel drives, blood drives, and the distribution of supplies throughout the COVID-19 pandemic. She also served as a county ambassador with the Global Peace Foundation to promote peace initiatives and entrepreneurial development. She knows that nurses belong at the forefront of every policy-making decision and takes every opportunity to make all of our voices heard. To quote her LinkedIn profile, "I work with my hands and from my heart, always ensuring that I leave the people around me better than I found them." Each of these individuals have inspired me, empowered me, and reminded me that I get to choose how history is written from each day forward. Each day is a new opportunity, and I hope that they have also inspired each of you to begin today with a voice, a quote, a tweet, or a promise. Please join me in congratulating and celebrating our incredible winners, Princewill Agedo of Nigeria and Zipporah Iregi of Kenya.
Oh, Amy, thank you so very much. Such a moving way to share stories and talk to us. A colleague of mine says that you give us goosebumps, and it's true. So thank you so much for all that you do, and really now looking forward to hearing from Zipporah and Princewill. Who's going to go first? I've seen you both, so I know you're there. Princewill.
Hello, good morning.
Hi, congratulations.
Yeah, thank you very much, Professor Prisa and Amy, for the introduction. I'm so humbled to be one of the guests, and of course, the receiver of the awards this morning. And to all my colleagues who have been celebrated, who have been awarded, I want to say congratulations to all of you for winning your various category. And this is just the beginning. We have a long way to go. And of course, there's much more opportunity to invest, advocate, research, and of course, fund global projects that will improve healthcare system in the world globally. According to the United World Health Organizations, 80% of the entire care that an individual needs his entire life can be provided by the primary health care. And of course, nurses are the custodian of the primary healthcare center. So we are essential to achieving the WHO and United Nations Sustainable Development Agenda for 2030. And of course, we have a key role to play in achieving universal health coverage to make sure that healthcare is affordable, available, accessible, and of course, reliable to every individual across every level of their development. Today, I'm super excited, grateful, and privileged to be one of the deserving awardee amongst millions of nurses across the world, clinching the award of Nursing Now Global for advocacy and of course for communication. Before I continue with my advocacy welcome address, I would just like us to have a moment of solemn and somber reflection of our colleagues in Ukraine. Over 300,000 nurses in Ukraine who are experiencing the worst state of their existence right now with the war crime around Ukraine. We are lending our hearts to them, and we hope that they continue to receive peace over their sky, and of course that we'll call on global leaders across the world to ensure they carry out proactive measures to make sure that every human in Ukraine do not deserve to wake up with a nightmare. And of course, to the over 3,000 nurses who died during the first and second wave of COVID-19 pandemic, our prayers and hearts are with them. And of course, we are hoping that the children, the offspring, and the spouse of these nurses continue to find strength from within to ensure that they make the rest of their lives the best of their lives. I'm also calling on leaders and administrators of those countries to prioritize investment in the spouses that have lost their life, and of course the children of these unsung heroes. Nurses are not heroes. Nurses are not angels, sorry, we are heroes. And of course, we do not live in the sky. We are humans. We deserve all the great things that we deserve as individuals. So I'm calling on state government, federal government to continue to prioritize investment in providing protective equipment for nurses across every level of their development. As a nurse advocate from Nigeria and as a global nurse leader, I've been involved in several advocacy projects from for my country. I just saw my colleague sharing a screen. I just thought it's not going to be a bad idea if I share my own screen as well. So I'm just going to share some screen. I just put out some slides in the last few minutes. Okay, so as a global nurse leader from Nigeria, as an advocate, I've been able to carry out some projects across my country. First, during the first wave of COVID-19 pandemic, we saw how COVID-19 exposed the weakness of healthcare system across the globe. Even the strongest countries, the strongest economy, their weakness was exposed. And of course, we saw the need for humans to come together to be able to carry out change. As a young nurse leader in my country, I was not quiet. I was able to bring about intervention that led to the provision of personal protective equipment to nurses across all 36 states of my country. This was the first time that any nursing organization or individual will do a project that will cut across all states in my country. As at the time of carrying out this project, I didn't have any registered company to my name. I didn't have any guarantor to my name. I didn't have any board of directors, anybody, but all I had was my voice. All I had was my passion. All I had was my enthusiasm. All I had was the need to be able to support nurses to be able to get personal protective equipment, because the rate of contractability of infection from patient to nurses was skyrocketing. I needed to do something about it. So I made an advocacy post through my communication and on social media. And of course, we got attention from the National Association of Nigerian Nurses in North America, who supported us with 5 million naira to provide personal protective equipment that was distributed across every state in my country, including the Federal Capital Territory. Despite the country being on lockdown, it was a big challenge. It was a big challenge distributing this equipment across all 36 states. For you to be able to carry out a project where all the states in your country get beneficiaries, it means you should have representative of all the states in that country. And because we were not partnering with the federal government and with the state government, it was an independent thing. I actually chair a hub of over 10,000 nurses. And from that hub, I was able to identify volunteers who were willing and capable to support me to receive this item on arrival at their state. And of course, take this item to the red zones in their various states. And of course, they were able to, the intervention was successful at the end of the day. Also, we were able to get collaboration through the 360-degree Health Network to win the Queen Elizabeth Commonwealth grant, where we were able to also get personal protective equipment across some of the tertiary institutions in Nigeria. And of course, we were able to get funds from Queen Elizabeth Commonwealth Trust as well, and One Young World Foundation to provide infection prevention and control training. We realized that when the COVID-19 started, many nurses didn't have any idea of how to treat COVID-19 infection. Although nurses are expected to be competent in infection prevention and control, but COVID-19 required a specific protocol and of course an updated way of managing the case. So there was a deficit of knowledge in how nurses can protect themselves and of course to protect their patients. In order for us to heighten the response rate, we're able to collaborate to get funding, to get access to face-to-face and online training to many of the nurses in private and public sector on infection prevention and control delivered by the London Professional Training Center in Nigeria. And of course, as a young advocate, we had a lot of intervention. I hosted the first Men in Nursing Assembly of Nigeria, despite being a young nurse at my country as well. And of course, we were the first organization to also host the Nursing Now campaign, which I was the proud project manager of in my country as well. As a young nurse leader for my country, I will just end my speech tonight by saying that as leaders and as advocates, we must understand that the world would not hand over what we deserve to us. The world will only respond when they see that we are innovative, critically, and of course, we act independent for us to be able to achieve what we deserve. We must transcend beyond the limit of hard work and of course, acknowledge that we must make sacrifice to make nursing work in our various units. Nursing is the sum process of every activity of nurses in every institution, organization that they find themselves. We must increase the urge for us to be able to embrace vertical and horizontal collaboration to be able to achieve what we want. As a young nurse leader and as a global leader, you must accept that you have strength, and of course, you must be able to identify your weakness. In your weakness, you then see the reason and the need to embrace progressive collaboration. Hard work can make us great, but we must then look at beyond hard work and making sacrifice. Hard work can make you a lawyer, but a great, only sacrifice can make you a lawyer like Nelson Mandela. Hard work can make you a nun, but it's going to take sacrifice to make you a nun like Mother Teresa. Hard work can make you a medical doctor, but something else will make you Socrates. Something will make you the founder of medicine. Okay, and of course, hard work can also make you a great and intelligent nurse as well. But it's going to take something else beyond hard work to make you a Florence Nightingale, to make you a Mary Seacole, to make you a Virginia Henderson, to make you a Lord Nigel Cripps, to make you an Howard Carter, Hannah Kennedy, Lisa Bratt, and all of the nurses, Elizabeth Evo, that are transforming agenda globally and of course, influencing healthcare practices to make sure that nurses become advocates of healthcare, providing, preventing, and of course, implementing changes that are necessary to improve the humanity condition in the 2022 century. Ladies and gentlemen, once again, I'm honored, I'm privileged, and I'm super excited to be one of the recipients of the Global Award. This is the first Global Award I'm going to be receiving. It means a lot to me. It means a lot to my family. And of course, I'm super grateful to have been a participant. Thank you very much to the Nursing Now campaign team and the later and all of everybody behind the backstage making this work. We really appreciate you, and of course, do well to make the rest of your day the best of your day. Thank you.
Oh, wonderful, Principal. Thank you so much. And it just is amazing what you've been achieving and what you've been thinking about and what you've been doing. It's and the influence that you're bringing to bear on the work that you do, but also on the wider profession. So please stay close to the Nursing Now Challenge and keep sharing your brilliant work and your inspiring ideas. And I love the thought that you've put into this speech today. So thank you so very much. Really appreciated. And now over to your equally amazing colleague that again is a massive supporter of Nursing Now Challenge. She's always there when we call on her, and she's got great ideas and advice to give us about what you're up to, Zipporah, and your amazing words. So many congratulations, and over to you to say a few words now.
Thank you so much, Lisa. Happy International Nurses Day, everyone. It's really excited to be here to celebrate it again with all of you. Thank you, Rose, and thank you, Amy, for that wonderful introduction. You brought tears to my eyes, literally. Thank you so much. I just want to say congratulations to all my colleagues who are here with me now receiving their awards. I mean, your work is just truly exceptional and mind-blowing. It's just an honor to be, well, seated here with you. So congratulations to all of you. I simply can't thank Nursing Now enough. My trajectory as a nurse simply changed, ever since I was introduced to Nursing Now. Thank you so much for the support you have given me and my colleagues to grow. Thank you for daring us to be drivers of change in our communities. Thank you for the provision of mentorship and leadership training we have constantly been giving just to ensure that we are being shaped to be the leaders of tomorrow. Thank you so much, even for the platforms you have given us to share our work and to work with you to improve nursing and improve the status and profile of nursing in the globe. Thank you so much, Nursing Now, and even for the organizations that have been working in the back end to support your work. Udet Trust, SEMU, JA Mental Health, Sabine Vaccine Institute, THET, WHO, ICN, and other organizations. Thank you so much for funding this platform to encourage us as young nurses to grow into our own leaders. As I was listening to every speaker give their keynotes, I could just pause for a second and think my journey is just beginning. When I grow up, I want to be the next Elizabeth Iro. I want to be the next Lisa Pratt. I want to be, one of the exceptional leaders. And it's just truly amazing to learn from you. Thank you for having charted the way for us to follow in, even as we look forward to the future. And I am excited about the future because clearly, we have young leaders who are going to ensure that it is a bigger and a better and a brighter future for health and for nurses globally. I also want to thank God for this opportunity to be a nurse, yes, and to be here receiving this award. And to my family, I know my mom hopped on this call. She's a very busy woman, an educator. I'm always constantly drawing from her strength and faith. So thank you, Mom, and thank you to my dad and my sister for the support they have given me in this journey. And I just, as I conclude, I want to say to all the young nurses, dare to step up. Dare to stand out and dare to use your voice because you are important and the potential you hold to drive change is just it's nothing short of amazing and exceptional. And we celebrate you already. And thank you so much, everyone.
Wow, thank you so much, Zipporah, and how amazing your mum's here. Wonderful that she's been able to celebrate this with you. Well, thank you, Zipporah's mum, for giving us Zipporah. She's just amazing, and I'm absolutely convinced that the next Elizabeth Iro is definitely within your chart. If that's what you want, I can see you there now, and I'm sure Elizabeth probably can too as well. So thank you so much, and keep close to us, and we look forward to continuing to support you and your colleagues as you continue to progress your amazing career. So without further ado now, we now move to a really brilliant colleague of mine actually that has taught me a lot about global health in general, and that's Ben, the Chief Executive of the Tropical Health and Education Trust. And I think it's really fair to say, Ben, that without your wise counsel and advice and the expertise that THET brings to the table, I certainly wouldn't have understood half that I was getting into when I actually signed up to Nursing Now and wanted to be part of this amazing agenda. So thank you for all that you do, and thank you for being here with us today to present the award around collaboration and partnership, because you have been a fantastic collaborator and partner to Nursing Now Challenge, and we very much appreciate all that you bring to the table. Thanks, Ben. Over to you.
Lisa, thank you very much. That really is high praise coming from you. So I'm very grateful. Thank you. I'm also absolutely thrilled to be here today as Chief Executive FET, just to record alongside you my excitement about the fact that this event is happening. So first of all, congratulations to everyone. I'm sort of acutely aware of how much organization goes into an event like today. It's very special, I think, for people who are receiving prizes, but also it's very special for all of us who are involved. I want to say Happy International Nurses Day, and I want to say for last week, Happy International Day of Midwives, because of course, some of you are both. It's particularly exciting, Lisa, to see collaboration and partnership being celebrated in its own category. I think this is part of the DNA of nursing and of healthcare workers more generally, of course, but it is also very much part of the DNA of FET. And we are in some ways best known for the work we do around partnership. So our passion, of course, is universal health coverage, is the quality of that health coverage. But the way we think this is achieved is very much through partnership. And what we do in particular is link health institutions in the UK with their counterparts in low middle income countries. And you'll see that our thinking is best expressed perhaps around the principles of partnership, which you can find on our website. And these principles of partnership, if you go to the website, you can click on them, and under each principle, you'll find a hallmark, and under each hallmark, you'll find case studies of how these principles are being brought alive through health partnerships in specific projects. So it's a library in the sky full of information about how to bring alive collaboration and partnership. Lisa, you said it, but there's, I think, the second reason why FET was invited to present this award was really around our enthusiasm for Nursing Now Challenge and for the Nursing Now campaign, which we supported from the outset. And we think the Nursing Now Challenge is just so important. It's so needed to support the work of Elizabeth Iro and colleagues at WHO. It's so important to keep nursing and midwifery visible globally and locally. We still have so much further to go, as I think some of the speakers have said, to recognize the vital contribution of nurses and midwives to achieve the triple gains that Lord Crisp outlined all those years ago, that improving health is, nurses and midwives are essential to improving health, but they are also essential to promoting gender equality and supporting economic growth. FET's passion for partnership, nursing and midwifery are brought together in a program we are running with the Nursing Now Challenge, which is empowering 61 early career nurses to implement quality improvement projects within their institutions and wider partnerships. I want to sort of praise people like Derek Bahandagira, who is a Nursing Now Challenge Fellow based in Uganda at Kasusu Community Health Centre. His innovation is around creating a new diabetic foot ulcer clinic with support from the University of Salford in England. I want to praise people like Syeda Akhtar, who is a midwife vice president of Bangladesh Midwifery Society, doing great work advocating for the needs of midwives in Bangladesh. We're thrilled that we have got the opportunity to run this program and to embed it within the health partnerships that we care so much about. Elsewhere in the world, we're constantly in the debt of nursing and midwives. So if I think about our work in Somaliland, where we're working on maternal obstetric and neonatal care for marginalized women. If I think about our work in Myanmar, where nurses are facing the brunt of a coup, and where we're working with Royal College of Pediatric and Child Health and others to give them support and training and knowledge at this time. So these are the reasons why I think I'm honored to be with you, why we are honored to be with you as THET. There are two very exciting winners of this category, however, who I need to announce with pleasure. One is from Malawi, and it is Lucy Makutamula. Lucy, I've already seen you. It's wonderful to see you in person, so to speak. And the other is Cecilia Ndungu from Kenya. Very many congratulations to you both. I know you are enormously proud, and you should be. It's a great moment. Thank you for inviting me to celebrate with you.
Thank you so very much, Ben, for those sincere words and helping us all to keep learning about the work of THET and the importance of partnership and collaboration. And we're delighted that we've partnered with you around the 61 QI Fellows. You know, it was a gem of an idea that's now turning into reality. And we look forward to seeing, no doubt, more brilliant work from those 61 amazing nurses and midwives. So I think without further ado now, shall we go to Lucy first and then Cecilia, who might want to say a few words? Congratulations both. It's fantastic to have you with us. Lucy, do you want to go first?
Sure. Thank you, thank you, thank you. I'm so delighted. I'm so humbled. It's an honor for Malawi. Thank you, Ben, for all those kind words. Indeed, yes, we had a partnership with THET. And, you know, we as Malawi, we believe in the future of the professions of nursing and midwifery. And we believe that the future lies in the young generation. And when Nursing Now Challenge came up and said countries should sign up for a project to actually mentor the young nurses and midwives, Malawi was one of the countries that signed up immediately. And let me mention, this was a work of a team of nurses and midwives in Malawi who all believe in one vision for the future for the professions of midwives and nurses. So therefore, we held a project that we mentored the young nurses out there in the facilities. We recruited 25 mentors against 50 mentees at a ratio of 1:2. And there were 8 facilitators from the Quad, and the Quad involves us from policy. Myself, I'm from policy because I work with the Minister of Health as Deputy Director of Nursing and Midwifery Services. And then there were also people from the regulatory body, which is the Nurses and Midwives Council of Malawi. We also had people from the academia. We also had nurses from the unions and associations. And we teamed up together to make up a team of facilitators who would go around to check the projects that the young nurse leaders were doing in the facilities. So basically, let me mention that these young ones had projects in the midst of the COVID-19 pandemic, and that delayed a lot in terms of our progress in their projects. These projects were meant to actually bring out the leadership skills in them, because the projects were to do with their work environment. They identify a change project in there, but they take up the leadership role in implementing that type of change that they would want to see. Therefore, we actually emphasize that they work as a member of the multidisciplinary team in their wards, in their departments, to bring about change and eventually also bring about skills that were hidden in these young ones. And it was a very big success. These young nurses, some of them up to now as we are talking, they have taken up the responsibility for quality improvement projects as coordinators in their districts. These are young nurses, mind you, below the age of 35, and some of them had only worked for a year or two, but they had already shown the potential to become leaders. And out of the projects, we have brought out the hidden skills, the hidden talents in them. And we, as Malawi, already see this as a future, because we are already planning to say this should be a national program and not a project. We have learned through TATE that it is possible to bring out leaders from, the young generation of nurses and midwives. And this will bring up a good generation of nurse leaders for the future. So we are already using that project to bring up now a program through the Ministry of Health that will see that we are always mentoring the young ones in the fashion that we have learned through this project. I am so glad, I'm so delighted. Let me mention that this trophy that is coming to Malawi is not coming to Luce as a person, it is coming to the team of nurses and midwives that actually played a big role in this particular mentorship project. Thank you, and over.
Oh, my goodness. Thank you so much, Lucy. And we're so lucky to have you as a champion for early career nurses and midwives, and the work that you do, the mentorship, the safety nets that you wrap around your early career nurses of what stood out so much. And we're delighted that you and your team have got this award. So thank you so much for joining us and backing Nursing Now Challenge. Thank you. And Cecilia, over to you now, one of our fantastic members of the Challenges Committee that puts so much effort in and again is consistently always there to support, to challenge that status quo and actually to make sure your voice gets heard. So over to you, let's hear you. Congratulations.
Thank you so much, Lisa Baylis and all the team for giving me this opportunity. Happy International Nurses Day to everyone around the globe. I'm so delighted to be getting this award in collaboration and partnership. And as a nurse midwife, I have been engaging in very many partnerships to support the nurse midwife workforce sustainability and have collaborated in various fields of health research and education. And I'd like to briefly give of what I've been engaging with. Previously, currently we are ongoing with a project with the Karolinska Institute in Sweden, whereby we've collaborated with this institute to bring about maternal health research in Kenya. And thereby I also urge for more partnerships since the project was running for 1 year. I call upon various stakeholders and partners to help us continue implementation of this project in Nairobi County, and also we can scale it up to the 47 counties in Kenya. Also, with Karolinska Institute, we have been able to do the alumni health collaboration. Thereby we discussed with the president on how to bring about future partnership of education, that is the nurses and midwives in Kenya, which will really boost the maternal health index. And it will also assist the nurses to grow career-wise and build capacity for them to be able to give quality service in their institution. I was glad to be part of the team from India, which is a charity organization. It's called Love Without Reason, whereby I mobilized patients across the country to attend the screening, and also the parents to accept and bring these children for screening, because we find that most of the challenges that we are getting as healthcare workers is that these parents, they have low self-esteem, they have not been able to accept the conditions of their children. And we had about more than 200 patients in the camp, and also mobilized nurses to volunteer, nurses and also other healthcare workers, because these required teamwork. I also collaborate with other institutions, the psychologists and the church, to educate our teenagers and adolescents on health matters, because we find that the transitioning from childhood to adulthood brings about many challenges which parents are not able to handle or address. And that's where we bring in nurses, and I mobilize them to be able to handle this accordingly. I'm glad for Nursing Now to offer me the opportunity to be part of them, and they have enabled me to carry out the Nursing Now webinar. We carried it with 3 nurses, with 2 other nurses who are based in the UK. This was to enlighten the young nurses and midwives on how to do their job applications. By this is how to do good CVs and application letters, which has really impacted more than 1,200 young and upcoming nurses in Africa and all over the world, because we had more than 1,300 attendees. I thank Nursing Now for that opportunity, and we are ongoing with the process. Last year, we had collaboration with other partners on psychological support and wellness. This was when COVID-19 had spiked up in Kenya, and we are having great numbers, and the healthcare workers and especially the nurses were having mental breakdown, and thus through the Ministry of Health, there was a partnership across all the associations to offer a call center, which I was the call center manager, which provided psychological support not only to the nurses and the midwives and the healthcare workers, but also to their families who were directly affected by the conditions of these loved ones. Also last year, we had a mental health series of webinars, which as the organizer, we were able to mobilize more speakers, me being one of them, and we are able to bring about various topics which were discussed to ease or to bring about the mental health trainings and knowledge. I've also collaborated with the other mission hospital, to be specific, North Kinangop Hospital in one of our counties. This was to educate mothers on the best child health practices. And this has really impacted the patients in that facility, and also the upcoming nurses and midwives in the facility, whereby they're able to educate the mothers and all the clients on nutrition and child wellness. In the year 2020, I am glad to have been part of the MIT COVID-19 Challenge Africa. This was a global platform which African all participants were meeting virtually. It was the first virtual sort of organization whereby various cadres, various expertise were able to come up with challenges and come up with solutions for those challenges in healthcare. And I partnered with the runners-up who happened to be in Kenya, and together with the Nursing Association in Kenya, we were able to host the first ever global nurses webinar in COVID-19. This was between the nurses in Kenya and Africa. And I also thank the support from Strathmore University, which was able to greatly support us in this facilitation.
Oh, brilliant, Cecilia. We're coming against the time, but it is amazing the work that you do. and the inspiration that you bring to us all, and the tenacity is just wonderful. So thank you so very, very much for all that you do, and the support that you bring, and the work that you put into the Challenges Committee, which, just as a reminder, is completely voluntarily. It's all about supporting each other. There are no rules, so you create your own community, and you're such a sort of force of positive influence, and we're very, very grateful for that and all that you do for us. So thank you so very much, and wishing you a wonderful day. It's brilliant to hear your work. Thank you, Celia. And now we move on to our last but not least award, which is the theme of compassion. And we could have put this at the beginning or at the middle or at the end or anywhere in between, because actually compassion is everything that we do, everything that we stand for, I think, as global nurses and midwives, and no better person, I think, Zhao, to be sort of announcing this award for us, because Zhao, again, you've been an amazing inspiration to us. We connected because we both had funded and been supported by the Burdett Trust for Nursing, and you've really helped to not only nurture our nurses and midwives that work on some of your programs, but also myself in helping me to understand actually the impact of mental health and the interventions and the work that nurses can bring to countries where mental health is perhaps still quite a relatively new topic to some and a new challenge to face. So thank you so much for your brilliant work with the Nursing Now Challenge, and over to you to present this award, and sadly the last award of the day that we've got. Over to you, Zhao. Thank you.
The last award, yes. Thank you so much, Lisa, for the kind introduction. And also, again, I know that's been said many, many times today, but happy International Nurses Day. So wonderful to be with you all here. My job, it's very office-based these days. So this is just so wonderful just to, again, be with you and hear about your stories and hear about the winners' stories and what's been achieved in the past few years. It's truly inspiring and an absolute honor. So my name is Rama Sabu. I am a mental health nurse and also the founding director, like you just said now, Lisa, of Jaya Mental Health, which is a UK-based NGO. And I'm also proud to say that I'm a Nursing Now Challenge champion. So I'm delighted to be here with everyone today celebrating International Nurses Day. Jaya Mental Health is, like I just said, a UK-based NGO led by nurses for nurses. And our mission is to improve the quality, the standards of mental health care, particularly in low and middle income countries. And we do so by supporting our nursing colleagues living in areas like, for example, South Asia, by equipping them with the skills and the tools they need to develop from a professional point of view, and by doing so to excel and ultimately have an active role in shaping mental health care in their countries. And through this process, we've been meeting amazing people. And like Dr. Rhoda Radula mentioned, whilst presenting the Nursing Leadership Award category, we do come across countless examples of nurses being the only carers available to hundreds and in some cases thousands of people, especially those living in rural areas of low and middle income countries. And therefore we see nurses as key components of communities that are often completely ignored, even by local governments and healthcare authorities. So nurses, and especially mental health nurses, and I'm a bit suspicious because I'm a mental health nurse and work with mental health nurses, not only provide care, but they really are also warriors fighting against the prevailing stigma that surrounds mental illness in so many parts of the world. Mental health continues to lack in many ways, and when we compare, for example, with physical health, tangibility, we don't always see a mental illness. So compassion and empathy and the ability to search and to look beyond what your eyes show your brain is a unique fundamental skill to nursing. And especially, again, I'm very suspicious because I'm a mental health nurse, but especially to mental health nursing because of that absence of tangibility. So for all these reasons, it's with concern that we're still seeing so many nurses having to leave countries and communities where they are desperately needed, having to look for work opportunities in other parts of the world. This is creating a huge void and in many ways making the challenge of achieving global healthcare equality even more complex and harder. So compassion is a fundamental value in everything we do. And I was actually looking for the actual definition of compassion on the Cambridge dictionary last night, which says that, just put my glasses, otherwise I can't see. It says that compassion is a strong feeling of sympathy and sadness for the suffering or bad luck of others and a wish to help them. And I mean, how descriptive is this of our role as nurses? And this also made me think of how relevant nurses truly are to societies, not just as compassionate caregivers, but as role models. I think we're living at the moment very strange times. We are hopefully getting close to the end of a post-pandemic period, the process that has had devastating effects across the world. We're watching every day on our TV, on our mobile screens, on our iPads, images of relentless, meaningless conflicts. We're experiencing changes on our climate that are creating a lot of anxiety in people, especially in young people. So in times like this, compassion and empathy, the ability to put ourselves on someone else's shoes really is needed in order for us to be able to move forward and find common, hopeful solutions that benefit everyone. So in these times of great anxiety, it's an absolute honor and comfort to know that nurses continue to be real examples of our most human side. And I think that's something that we should all be proud of. So for all these reasons, I'm really honored and really delighted to announce the winners of the compassion category. 2 winners like the previous categories, and they are Mohammed Ali Badir and Ander Vigi. Mohammed and Anger, let me read what the judges had to say about you, and I'm sure that you'll have lots to add afterwards. So Mohammed was deeply affected by the 2020 explosion in Beirut and the pressures of the COVID-19 pandemic. So Mohammed is a charge nurse in Al Musa Specialist Hospital in KSA with 6 years experience of nursing. His mental and physical health was under immense strain until one day while working, he suffered a cardiac arrest. Mohammed strongly believes that his recovery is the result of the compassionate care he received, and this propelled him to look into compassion and the wonders it can do to healing. Mohammed believes that compassionate care brings optimum patient healing, and he continues to practice and advocate for compassionate care through nursing in one of the leading hospitals in KSA. Absolutely amazing, Mohammed, and I can't wait to hear more from you. Anders Vig is Head of Quality Improvement from the Norwegian Institute for Public Health in Norway with 30 years experience. Anders is a senior nurse. He has led many quality improvement and innovation projects across the system with a particular focus on long-term care and care for older adults. He has been a leading figure in the What Matters to You movement, the WMTY movement, inspiring action all over the world. So Anders held the first ever national WMTY day in Norway in 2014, a practice initially that spread to Scotland and then to over 50 countries and more than 2,000 healthcare teams. That's absolutely amazing. He also leads a national collaborative program in Norway to redesign care pathways for older people. His innovative and compassionate perspective has stimulated new ideas for improving care, from safety to patient and family experience to sites of care. His work has inspired healthcare leaders and caregivers to think about a person's full capabilities and what matters most in designing care pathways, all leading to better outcomes. Anders speaks at conferences worldwide on ways to inspire innovation and compassion as key to care in this time of COVID. He is a true and humble example of how nurses can change healthcare globally. So huge congratulations to both of you. And over to you, maybe Mohammed first and then Anders, or the other way around. I leave that up to you. Congratulations.
Thanks
thank
so
you
much.
so much.
Mohammed, go for it.
Yeah,
Congratulations.
Thank you so much for this this award, and this I'm honored, and it's a privilege to be with you all today on International Nurses Day. You couldn't have put it much better. I did have an experience, and this experience really changed my vision towards compassion, and I wanted to advocate for compassion a little bit more. I'll start my story with the COVID-19 pandemic. I was an ER nurse in Lebanon, and the peak of the pandemic had us all really tired, all really stressed out. And we saw a lot of patients who passed away in the ER, families broken down, and this made us want to work more, give more from our hearts, and be compassionate with the family, be compassionate with the patients throughout the journey of their illness. The second phase of what happened was in August 4, Lebanon, and especially Beirut, witnessed one of the biggest explosion recorded. And during the explosion that day, all nurses around Lebanon, they remember everything vividly. I cannot really put or describe what we saw. I cannot describe what we had to do. Hundreds of people died, thousands injured. People lost their houses, people lost their loved ones, they're missing people for 3-4 days under the ashes of the explosion. And it left us in ways that I cannot even describe. It was devastating, truly disastrous. And any disaster plan was not really, it wasn't even close to what happened that day. After that, on February 3, 2021, while I was at work, I had a sudden cardiac arrest. I'm not going to go through the reason why that happened, but what happened afterwards was me being admitted to the ICU, me being admitted after the ICU, I went to a telemetry, and then I went to a normal ward. And I felt the nurses' compassion, not only like my family and friends, but the nurses who are working there in the ICU, nurses who are working in the ward. They showed me compassion that I was thrilled with. I felt like this is a really good part of my recovery process, and something that really stuck in me. So I thought to myself, like, what if all the patients get the same treatment and the same compassion that I did? And therefore, after I was discharged and I was home, I thought a lot about what happened, and I wanted to do my own research about compassion care. And I saw yes, we can do training for nurses in compassionate care skills. And another thing I'm currently working on is a platform called the Nurses Talk, where nurses actually come up, they talk about stories where they touched people's lives, where they made a change with with one word, with one touch, with anything that they can do. And always I hear stories about compassion, and they say that it is a privilege for nurses to work with these patients. And this platform will also tackle topics like moral injury, compassionate fatigue, and the purpose of this is, according to Dr. Jane Watson, and her very famous quote, and I love this quote. It says, "We are the light in institutional darkness, and with caring, we go back to the light of our humanity." What we really want to do is to bring back the caring aspect of nursing into healthcare. And what you want to do also is to market nursing, to market our nurses, and to retain the nurses. Because what we can do is we can shine the light on the caring process of nursing. And by that, we can really recruit more nurses, recruit people who are loving, who are humanitarian, who are people that are passionate in what they do. And again, thank you so much for this award. I will keep on advocating for compassion all my life. And thank you so much for this opportunity. Really, words cannot put how I feel right now. Thank you so much.
Well, Mohammed, thank you. And thank you for sharing your very personal story with us and all that you do for nursing. We truly appreciate it. And keep going, just keep going. I think that's the key.
Thank you so much. Thank you.
And now we'll go to Anders from Norway. So Anders, congratulations. Delighted that we've got Norway on the map, and we're learning more about Norway all the time, which is wonderful. So over to you if you'd like to say a few words.
Thank you so much, Lisa, and Joao, thank you for wonderful words. Thank you so much, Nurses Now, for this prize. Happy International Nurses Day to all nurses following this. I'm proud to be a nurse. But I have to say, I received this award on behalf of great partnership and teamwork. Nationally partnership with my colleague and friend Sigrid Askum, I have to mention, from the Association for Local and Regional Authorities, and the teamwork between our two organizations. And I also like to receive this award on behalf of Partnership internationally with my colleague and great friend Sean Marr from Scotland, and the teamwork we experience in the whole global What Matters to You network. Let me say, I see compassion as the hope for future healthcare. So in Norway, we created regional learning networks to better pathways for elderly starting in 2014. This were inspired by Keynote from Maureen Bisognano, and we had 2 interventions for local quality improvement work in the region to create better transitions, cooperation, and content in the pathways for our patients, and to change direction of healthcare by asking what matters to you. A new partnership between nurses and other health professionals and their patients based on us asking patients what matters to you. The question can change the relationship and the outcomes. We have seen how the question can change healthcare to create better health, functioning level, and daily coping for our patients. When we introduced it in our collaborative, the question got to everybody's head and heart as the right thing to do. But it was very difficult to implement. The question was very big, and it could create a tsunami of needs, was the scared reaction from colleagues. We couldn't give it up. So we came up with the idea to have a national What Matters to You Day in Norway to strengthen this intervention and this cultural change. Remember, we are trained not to ask what matters to you, but to ask what's the matter. So it's all about moving from what's the matter, small questions, to what matters to you. As you said, Joao, it's spread to Scotland and a lot of other countries, and the group movement globally is growing still. It's about asking, it's about listening, And it's about creating goals together with our patients and set up action and check if the action creates improvement for the patients. Compassion, partnership, and what matters to you is part of the hope for future healthcare. And if you found this introduction a little bit interesting, you could find more in an annual report from 2020 attached to this Zoom arrangement written by Kristin Tveitnes from our partnership. So thank you on behalf of both my colleagues and my partners. This is a true honor. I feel very happy today.
Oh, that is so wonderful, Anders. Thank you so very much. And thank you for your support to Nursing Now Challenge, and thank you for your leadership. What matters to you is, you know, it is really becoming a global movement and makes people think differently, starts those different conversations. And we look forward to hearing and learning more about your superb work and that of your colleagues out of Norway. So thank you so very, very much. And it's now time really to come to questions and answers, but I think the stories have been just so amazing and somewhat emotional perhaps at times for us. It's probably quite hard for people to think, well, what questions have I got? But this is an opportunity if people do have a question. And maybe it's just, maybe Anders, I'll just come back to you to say, from Norway, listening to the wonderful stories today and listening to people's passion, are you surprised that we've got so much amazing nursing practice, innovation, compassion, research and energy within this network?
No, I'm not surprised at all. I think nurses have leading parts in this kind of work all over the world. I think what is so important is to bring us together so that we can inspire each other, crossover for topics, and really build out the actions in each and every country. I think it's very inspiring, Lisa. It's so great to follow all the prize winners today and hear them, their achievements.
Thanks, Anders. That's lovely. And then Lucy, I might just come to you. You know, you've got such a senior role in Malawi, working with the Ministry of Health. You know, what's your takeaway from today? Have you been inspired? What shall we do next from your perspective?
Greatly inspired indeed. In fact, you do small things at country level and you never know how much impact they are making on a global platform. Yes, so I'm so inspired. In fact, from here now is to motivate the nurses to do even more, the nurses and midwives of Malawi. Thank you.
Oh, thank you, Lucy. And actually, that's such a good point, that lots of little things make a big impact. And I certainly think with, you know, having the privilege of coordinating this amazing network, we do lots of little things. We don't know where we're going sometimes, we don't over-engineer it, but all of a sudden amazing things pop up, like the winners and the work that's going on today. So what a super reminder. You don't have to do great big monumental things to make a difference or to start change happening. So thank you for those wise words, and keep up the amazing work that you're doing with your ministerial colleagues in Malawi. Thank you.
Thank you so much. Thank you.
No, you're very welcome. And then maybe Jenny, Jenny from SameU, is there any thoughts from you? You are so passionate, not only about the work of nurses and midwives, but also about the neuro-rehabilitation agenda, and you know how we can raise the profile of this important nursing specialty. And actually, again, perhaps a little bit like what Lucy said, it's not great big efforts, it's lots of efforts that actually can help improve somebody's life after having a brain injury. So a few words or thoughts from you, if I may.
Yes, of course. It's a really great question for today, because I've been struck by listening to all of the amazing people who've spoken, both the winners and other people involved with Nursing Now, who are putting their time into helping support early career nurses. And it strikes me as that, you know, the word compassion is incredibly important, and it covers everything. But I think that from the point of view of trying to encourage more nurses to take up neuro rehabilitation, I would like to just say that when we first started, there was people said to me that it was a very depressing part of nursing to go into. And I really struggled with that. And it's really, to understand that, I think it's about understanding that in the past, people have found that it was a very difficult area. But there's so much innovation that we've heard today that it can be applied to neurological care. There's so much data that we're all trying to gather, so the need, and there is such a huge unmet need. And the thing that links it all together is really patients' and survivors' mental health. And so the mental health recovery aspects are very, very close to my heart, and to all of us, all our thousands of people who follow and support us. And so I'd just like to say, if you all think that there could be some elements of your work with compassion in your day-to-day life that you think that we could benefit from, to understand what you do and how you do it, I'd love to hear from you.
Super. Well, thanks so much, Jenny. And that challenge is firmly thrown out to our audience, and I'm absolutely sure we will not be disappointed in what comes back. So a huge thank you, and thanks again for all your support to Nursing Now Challenge. And I think if there are no more questions, now's just a time to sincerely thank all of our panel members and all of the people that have joined us today to listen and learn and have knowledge exchange, and to be part of this wonderful celebration on International Nurses Day. I'd just like to say a huge thanks. I love being part of the family. I love being connected to you all, and I love to learn from the work that you're doing. So I hope whatever time of day it is for you, that the rest of your day is wonderful, and that you keep doing the brilliant work that you do, and keep connected and close to what we're doing as well, because we're stronger together. We're a force for change, we're a force for challenge, and we're certainly a force for good. And the more of us that can be part of this, then the stronger that will be. So thanks again to all of our panel members and all of you for taking the time to join us. Huge congratulations to the winners, and also not least my wonderful team, Hannah and Andrea, that actually make all of this happen. Without them, this wouldn't be so. So a huge, huge congratulations to them, and my thanks don't really say enough. Have a great day, everybody, and a wonderful International Nurses Day. Bye-bye.
Bye.
Bye.